Is my surgery over? What time is it? Wow, I'm in the recovery room. My surgery's over. Wow. Wow. Like literally, it's like amnesia. Hello, welcome back to my channel. It is Michelle here, Nurse Michelle here. You are on a channel where I make nursing videos, lifestyle videos, and faith-based videos. I like to talk about Jesus. If you like content like that, please don't forget to hit that subscribe button and give this video a big fat thumbs up because it's going to be a good one. So let's get into it. I have been a Pacu nurse for almost 3 years now, and I have a lot to say about the specialty. So this video is going to be very informative. I'm going to be listing some characteristics that might not merge well with the Pacu world. So if any of the things I'm going to be mentioning resonates with you, then I don't think that you will fit well in that setting. So definitely use this video as a self-assessment video to see if you are going to enjoy working in the Pacu or if it is a good fit for you. So let's get into these characteristics. If you're not a detail-oriented individual, you are not going to do well in the Pacu. So Pacu requires a lot of attention. Like, these patients require a lot of attention. It's critical to be detail-oriented because that could be what leads to escalating care to the patient, therefore potentially saving their life. So in the Pacu, we take care of a lot of vulnerable patients. So a lot of these people might be compromised one way or the other, especially airway. With anesthesia, these patients sometimes come out with a very decreased level of consciousness. So you are like their eyes, you are monitoring them closely, and it is imperative that you know what to look for, what signs to look for if the patient is indeed deteriorating. So you have to be very detail oriented in order to work in the Pacu. Another thing to mention is because the Pacu can get very routine, it's more likely for you to miss something important, which can lead to an adverse event occurring to your patient. Because you routinely see the same surgeries over and over again, you assume that these patients will all recover the same, but that's not the case. This is why being detail oriented is so important, because you're able to pick up the little changes in your patients, which will lead to you saving their life. If you feel like you're not the type of person that can pay attention to detail, then the Pacu will not be a good fit for you at all. Number 2, if you do not like having conversations. So in the Pacu, the ratio to the patients are 2-to-1 or 1-to-1. In the Pacu, you're working in close proximity with your patients. You are literally in bays. So there's one patient here, one patient there, and you're sitting in the middle. You're very close to your patients in order to, help them in case they need anything. So you're right next to your patient. And as these people are waking up from anesthesia, there are some talkative individuals. And so they will try to engage in conversations with you. So you'll realize that you're spending most of your shift talking to people. And if you feel like you're not the type of person who likes conversing with people, you'll end up really hating your job, because that's what 50% or maybe 70% consists of as people are waking up from anesthesia. And also because they are under the influence of anesthesia, their mental status might not be completely there. So there's going to be a lot of repetition. They're going to ask you the same questions over and over again. Is my surgery over? What time is it? Wow, I'm in the recovery room. My surgery's over. Wow. Wow. Like literally, it's like amnesia. Anesthesia can cause people to have amnesia. So as people are waking up from anesthesia, they're going to be very repetitive. And if you're the type of person who can't tolerate having conversations, can't tolerate people, then you might find that very annoying, which can then decrease your job satisfaction. So yeah, if you're not a person that likes conversation, then you'll probably not be happy in the Pacu. Hey girl, I'm on my YouTube.
Oh, wow.
So this segues into the next point. If you are not a patient person, then the Pacu will definitely not be for you. As I was mentioning, that a lot of people come out of anesthesia having amnesia, and where they're just very repetitive. So if you're not a patient person, you'll find yourself getting really annoyed very easily, and then you'll end up being miserable working in the Pacu. So along with patients in the Pacu, because the care is so close, like you're literally so close to your patient, your job is to make sure that they're meeting all their requirements before they get discharged. So as far as pain management, you need to possess some patience, because everyone's pain tolerance is different. So one person might require only 50 mics of fentanyl to feel better, and where another person, it can require 100 mics of fentanyl, 2 milligrams of Dilaudid, and a Percocet pill before they'll start feeling better. So you need to possess patience in order to deal with these people. You can't just say, oh yeah, I'm only giving you this much so you can leave and get out of my care. You can't do that. You really need to sit down and just be patient and treat each individual as an individual and not place everyone together, because people present with pain very differently. Anesthesia can either bring the worst out of people or like the good out of people. You're taking care of people under influence. You know, it's very similar to someone being drunk. A lot of the patients sometimes wake up and say, oh, I'm on cloud nine, or they'll say, man, I feel very drunk right now. That's the kind of feeling that anesthesia gives people. So there are people that come out, especially women, young women, that come out literally crying, like very emotional, and they can't really help themselves because they're under the influence of anesthesia. And as the nurse, you are supposed to exercise patience with these people and try to get them to calm down. And so you're going to be working with people that are going to be under the influence of anesthesia, and it requires a lot of patience. You might also encounter people who are a little combative with anesthesia or a little bit more aggressive. So you need to exercise patience. And if you feel like you're an inpatient person, then the Pacu setting might not be the right fit for you. So the next point is, if you don't work well under pressure, then the Pacu might not be the right place for you. Pacu is considered critical care, so you will encounter a lot of critical situations, mostly airway situations, in where you'd have to re-intubate your patient. You're going to know exactly what to do in terms of situations like that. So therefore, you can't crumble under pressure, especially if you choose to work at a level 1 trauma center or at a teaching hospital, and where they see a lot of acute patients. That setting will not work well for you. So the next point is, if you're unable to work under a fast-paced environment. So the Pacu can be very, very fast. The patient turnover rate is so quick. On average, people spend about 30 minutes to 2 hours with a patient, and they're constantly being rotated out. It's almost like an assembly line. It's very pivotal to work at a pace in where it keeps the flow going, because patients are being rotated out through bays, and if you're stuck with your 2 patients for 5 hours, that slows the entire unit down, therefore causing stress on your coworkers and the management. So it is very important to know how to work in a fast-paced environment, because when you slow down, it slows everybody else down, essentially. So being able to work in a fast-paced environment, it requires you to effectively manage your patients. So in my hospital, we have standard orders for every patient. So for our pain management, we can give 25 mics of fentanyl every 5 minutes as needed if the patient has pain. In order to keep the flow of Pacu going and not slowing everybody down, you have to be able to manage a patient's pain well. So when you ask a patient if they're having pain, you give them 25 mics of fentanyl. Per the order, you can give another 25 mics in 5 minutes. So when 5 minutes passes, ask that patient again, hey, are you still having pain? What would you rate it? What number would you give it? As you're assessing, you're medicating. You can't give the patient 25 mics of fentanyl and 30 minutes later ask them if they're having pain, then give another 25 mics of fentanyl. Because every single time you do that, that buys the patient more time in the Pacu, therefore slowing down the entire unit. So there's like a method to how the Pacu works. If you're not able to work with a rhythm, in a fast-paced rhythm, then the Pacu will definitely not be a good fit for you. So definitely take that into consideration. If you're the type of person that likes routine, then the Pacu might not be a good fit for you. So the reason why I'm saying this is because the Pacu can be very unpredictable. Each day, the amount of surgeries you have and the type of patients you see are very unpredictable. You can't really gauge staffing. Like it's very difficult to staff people in the Pacu. Therefore, your shifts can look really different. There will be one day in where you'll have a lot of resources, and the next day you might not, just because of the amount of patients you're having, the type of patients you're having, and so on and so forth. So if you're the type of person that can't be flexible and work under unpredictable environments, then the Pacu is definitely not the place for you. So if you can't tolerate working in a cold environment, then the Pacu is definitely not for you. So the Pacu and the OR are kept at extremely cold temperatures for a reason. One being to decrease the level of infection because of like sterility. The Pacu and the OR are kept at really low temperatures. So if you're the type of person that can't tolerate working in that environment, if you're a summer person, if the cold doesn't bother you as much, then you'll be able to survive. But if you're the type of person that maybe gets some pain, some bone aches when it's cold, then the Pacu might not be a good place for you because the temperatures are always so cold. So with all of this being said, take these into consideration before you apply for your next Pacu position. I hope that this video helped you guys make the decision in whether Pacu is the right fit for you. Give this video a big fat thumbs up if it was informative. Comments, let me know your thoughts on this video. If you're a Pacu nurse, what else can you tell the people out here? Let us know what you think. As always, thank you guys so much for watching this video, and I'll talk to you guys in my next one. Bye.